Two short presentations before lunch will be from the first of several of the vaunted graduate students. So I'll ask Hannah McCarthy to make her way up to the front here for the first of those. So continuing on the CAF theme, Hannah is a graduate of Mike Steele's lab, and will talk to us a bit about colostrum beyond the first day of life. Over to you, Hannah.
So I'm Hannah. I just recently finished a master's with Mike Steele, and I'm going to be discussing colostrum beyond the first day and also a little bit about colostrum feeding strategies. So just to start about why we really care about this, I think everyone here probably knows that the pre-weaning period is extremely important. We know that the pre-weaning period carries implications for the cow's entire lifetime. So we know through previous research that health, growth, as well as management factors such as feeding scheme can impact age at first lactation, as well as lifetime milk yield, both of which are going to overall impact the profitability of that cow. So we know that our pre-weaning period impacts our total herd profitability, so we still need to focus a lot of research in improving growth and health during this period. And as Dave was saying, the number one way to look at growth and health in the pre-weaning period is to focus first on our colostrum. So our calves are born immunologically naive, meaning that they have very low levels of immunoglobulins circulating in their bloodstream at birth. And they receive those immunoglobulins through transfer of passive immunity via the dam's colostrum or colostrum placer. And when we're talking about calves, we're mainly talking about immunoglobulin G or IgG. As Dave was also saying, we used to deem successful transfer passive immunity at greater than 10 grams per liter of IgG in the serum of the calf at 24 hours of life. However, new recommendations are suggesting that we should be looking a little bit further with the recommendations of the categories of poor, fair, good, and excellent. And we know that when you increase between fair and good and excellent, you're having a reduction in mortality. And when you increase between good and excellent, you're having a reduction in your morbidity rates. And when you look at the composition of colostrum, we can see it's quite different to that of mature milk. You are higher in immunoglobulins, higher in protein, lower in lactose, and fat can be variable, but it's often quite different. And I also want to point out here, and I'll get back to that a little bit more later, but when you look at your transition milk, again, we're higher in protein, higher in immunoglobulins, lower in lactose, so it's also quite different to mature milk. So to start with the basics of colostrum, I'm sure everyone in this room has seen some variation of this slide. We know that when you're feeding your calf, your colostrum, when you first get that calf at birth, you want to focus on quality. You want greater than 22% Brix or 60 grams per liter of IgG. You want to be feeding greater than 10% of the calf's body weight in the first 12 hours of life. Preferably, you want to be feeding it within 1 hour of life. However, that can be a little difficult when you have a calf born at midnight. And you want your colostrum to be quite clean at less than 100,000 colony-forming units. But I'm going to focus a little bit on what to do if you don't have this, specifically on our quality. So this study was done by a previous PhD student in the Steele lab, Dr. Alberto Lopez, and he looked at feeding calves maternal colostrum at different levels of quality. So we have our low quality, which is our 30 gram per liter, our good quality, which is our 60 gram per liter, and our high quality, which is our 90 gram per liter. And I think we can see a very clear relationship there. As you increase your quality, you're increasing the serum IgG levels of your calf at 24 hours of life. Specifically, our 30 gram per liter calves were in the fair category, our 60 gram per liter calves were in the good category, and our 90 gram per liter calves were in the excellent category of passive transfer. But what do you do if you don't have good or excellent quality colostrum? What Alberto looked at was mixing in a high quality colostrum replacer into that 30 gram per liter maternal colostrum, and can you then increase that quality and provide higher levels of passive transfer? And when he increased from 30 gram per liter up to 60 gram per liter by introducing colostrum replacer, you can see there was a pretty large increase in the serum IgG values at 24 hours of life. Those calves went from being in the fair category of serum passive transfer up to the good category. We also tried to increase from the good colostrum to the excellent colostrum, again by adding a colostrum replacer. This, however, was not quite as successful. We saw a marginal increase, however, it was not statistically significant. So maybe this didn't work quite as well. We don't quite know why that is, but it's possible it had to do with the osmolality of the colostrum after mixing in that replacer. But what we found from this was that you can enrich your low-quality colostrum with colostrum replacer to increase your levels of passive transfer that you can achieve. In further looking at other ways to increase that passive transfer level, I'm going to talk about colostrum beyond day one. So this is another study that was done by the Steele group, however, back when Mike was at the University of Alberta. This one here was done by a previous master student of Mike, Jade Pio. And in this study, they fed all the calves a common meal of colostrum at 0 hours of life. As of 12 hours, calves were either fed colostrum, transition milk, or whole milk until 72 hours of life, at which point they were euthanized, and here are their intestinal sections. So we can see when you compare that whole milk section on the far right there with our transition milk and our colostrum, both the colostrum and transition milk calves had much more intestinal development compared to that whole milk calf. And to get back to our serum IgG levels, so these are our calves at birth, very low levels of IgG in the blood. After that first meal of colostrum, that they all received the same meal, we're seeing the same increase. They're getting up to near 20. But when we get to that second meal where they received either colostrum, transition milk, or milk, there's a very, very clear pattern here. As expected, our colostrum-fed calves, of course, had the highest levels of serum passive transfer. However, those transition milk calves did have improved passive transfer when compared to the milk-fed calves. So perhaps if you don't have enough colostrum to be feeding two diets, or you're unable to feed colostrum replacer for any sort of reason there, transition milk can also provide an increase in serum passive transfer of immunity. Now from this project is kind of where we went into my master's work. So we wanted to further look at feeding colostrum beyond that first day of life. And to do this, we enrolled 200 heifer calves with 50 calves spread into 4 treatments. All of our calves, regardless of treatment, received 2 meals of colostrum at 0 and 12 hours of life. Then we had our 4 diets. Our control calves were kind of the standard. They received those 2 meals of colostrum before going on to milk replacer at day 1 of life. Our transition-fed calves received a 50-50 mixture of milk replacer and colostrum replacer on day 1 and 2 of life, and then went on to milk replacer on day 3. Our extended colostrum calves were fed a 90% milk replacer, 10% colostrum replacer from day 1 to 14 of life. At day 15, they were fed just milk replacer. And finally, we kind of had the extended with the transition where we had those 2 days of the 50-50 mixture before they were fed the 90-10 mixture from day 3 to 14. Again, day 15, all calves were fed milk replacer and they were weaned on day 49. And we looked at a bunch of different things in this trial. We looked at their growth, serum IgG, health, mortality, but I'm just going to highlight a few of the key results. So here is a survival chart for diarrhea, and we use that scoring system that Dave was describing earlier. If a calf had at least 1 day of a 2 or a 3 fecal score, then that was considered a bout of diarrhea. And if you look at this survival chart and you read it from left to right, we start at the top there. Day 1, 100% of my calves were healthy. As we move across time here, we have our calves dropping off as they undergo bouts of diarrhea. And we did have a significant impact here where there was a reduced risk of diarrhea for the calves that were fed either the transition diet or the extended colostrum diet. And that was also shown through our mortality rates. Same thing here. We saw that there was a significant reduction in the risk of mortality for the calves that were fed either the extended or the transition milk diet. You can see a pretty large decrease there, going from a 20% mortality to a 8 or 10% mortality for those extended and transition fed calves. Now, a few take-home messages from these studies here. We know that we can enrich low-quality colostrum with colostrum replacer to achieve passive transfer of immunity. We know that extended colostrum feeding can improve our intestinal development, increase our serum IgG concentrations, as well as decrease pre-weaning diarrhea and mortality. Now I want to talk a little bit about the next steps for colostrum research in the Steele lab. So we've looked at feeding it long-term, we've looked at how we can increase our serum passive transfer immunity. Now we're trying to look at a little bit, is there differences between different calves? So this current study that we have, our calves are approximately 13 weeks old at this point. So what we're looking at now is the effect of colostrum quantity as well as breed on our IgG kinetics, health, and growth in Holstein and crossbred bulls. So we enrolled 24 Holstein bulls and 24 Holstein Angus crossbred bulls at birth, and they were fed either a high or a low colostrum. And for this one, I assume a lot of people here probably realize your Holstein bulls or your Angus bulls or crossbred bulls are not the same size. So our high and low were based on their birth body weight, and they were all fed either 5 grams of IgG per kilogram of birth body weight or 2.5 grams of IgG per kilogram of birth body weight. And all calves, again, received 2 meals. So at this point, our calves are 13 weeks old. They are now all living at the Elora Beef Research Station, and hopefully we'll have results on this one out soon. With that, I'd like to thank, of course, the Steel Lab who did all this research, the staff at Walker's Farms. A lot of these studies were done there, and they are amazing, and of course, all the funders.
Thanks, Hannah. Questions for Hannah? Okay, farmers in the room, quick audience poll. Hands up if you're feeding colostrum after day 1. Okay, good. That's a good start. And the rest of you learned something today. At least an opportunity has been put forth. Really good. Laura.
How much of the colostrum replacer did you add to the
To which diet?
to the low quality colostrum?
To the low quality. So I'd have to check the exact, but I believe it was about 500 grams of a 27% IgG colostrum. So it was about half a bag of a normal bag.
Thank you, Hannah.
No problem.